Mohamed Hamami, Chief Health Strategist. Today I will be giving the usual case numbers and an update on where we are, but I also would like to give you a little bit of our efforts to expand capacity and access to vaccines in Wayne County. So if I may share with you some slides. And I hope you can see my screen now.
Yes, we can.
Great. So let's start with the weekly case reports. This week is a relief because it is the first week in at least 3 weeks where we are seeing less cases. Our numbers have decreased by 9% from last week. It is still on the higher side, as you can see, 5,565. That is still way above the 900 and 600 that we enjoyed early on in the year. The death count has also decreased. I believe last week it was close to 30, and now we're at 12 cases. And if you look at the graph, also the 14-day look back is decreasing, which is exactly what we would like to see. The same applies. This is the first week where we see our positivity rate decreasing. And as you can see from the 2 periods before, it was on a climb from 18.3 for Wayne County to 19.5. We, as of yesterday, are at 16.3% for the county and 14.1 for the state of Michigan. So hopefully these are good signs that we are turning a page on the numbers of increasing. The same applies for most of our communities that are usually in the top 10 category. Not much has changed except some trading places. Almost all of the communities except with Dearborn and I believe Westland have decreased. I'm sorry, not Westland. Dearborn have decreased in their total number of cases, but in terms of the percentages, still, as you can see, Dearborn is the highest at 12%, followed by Westland at 8%, Canton at 7%, along with Livonia, 6% for Taylor, and 5% for Redford and Dearborn Heights, and then Belleville, Lincoln Park, and Southgate at 3% each. And then as far as the school-related cases or outbreaks, there were 3 new ones this week. Those that were are still ongoing. The outbreak happened in previous weeks, but we're still following up on that. But those 3 that happened this week, as you can see, they were reported on April 15th, are in Canton, Highland Park, and Northville. 2 of those are in elementary school, and 1 is in a middle school. And we are back to seeing cases in staff and in students. We had a period where mostly it was in students, and now we're seeing a little bit of a mixed batch. So we're investigating those to see whether the staff involved were vaccinated or not, and if so, then we will follow up on that. The variants have also been increasing. Still, as of today, the majority of the variants that we see are the B.1.1.7, which is the United Kingdom variant. The B.1.429, the California variant, is also increasing. And we have just registered 2 cases of the P.1. This is the notorious Brazil or Japan-Brazil variant. This is one that we just documented it in Wayne County recently on March 29th. What does that mean? Because we know these variants are very highly spread and they have an increased transmissibility rate. I expect that the more we're going to test for the variants, we are going to find them, and we will see more of those. Because these are variants that have a higher virulence as well as a higher transmissibility, then again, this is where the emphasis on isolation of cases, the emphasis on physical distancing and face covering becomes very important. And that is probably a little insight to why we were seeing those high cases, because you have now less viruses that are needed to spread, and that's where we saw most of those spikes. As of last week, exactly on April 8th, we opened up all categories. So uh, technically, we are vaccinating everybody that is 16 and over in Wayne County at our sites, and I will talk a little bit more about our sites as we move to our next plan. This is our vaccine inventory. We have received, as of last Saturday, 264,150 doses of all vaccines. We have administered 22, that doesn't sound right. It should be
Yeah.
229,902. And we redistributed close to 50,000. By redistribution, as I mentioned in the past, it is giving it to other entities that can vaccinate. Now, all of you are aware that the Johnson and Johnson is on hold. We still have close to 9,000 doses that we are not using, and of the 12,800 redistributed, I believe Dearborn Fire Department has 4,000 and Livonia Fire Department has 3,000 that they are also not using until further notice. Um, I wanted to take this opportunity to talk to you a little bit about our efforts to expand our vaccine access in Wayne County. So as you know, so far we have been operating consistently at two locations. One is in Livonia, which is Schoolcraft College, and the other is in Taylor, which is Wayne County Community College. One was designated specifically, which is the Taylor site for Pfizer, and the Schoolcraft College in Livonia is designated as Moderna. With more shipments of vaccines that we are getting, and also the demand of opening up to the category groups, we needed to expand our capacity. So we knew that we needed to have a robust scheduling system that can offer appointments. We heard about the challenges that many of our county residents, and specifically the seniors, that were unable to get vaccine appointments by going online. We also needed a system that can track our vaccine and keep the inventory of doses that administered and doses that were remaining. And also we need the capacity, the manpower to administer more doses. And we needed to have more local access to vaccine by having more geographically distributed sites that people and residents in Wayne County can access. So with those 4 points in mind, we started with launching our own call center. The call center has been launched on April 8th, and it operates 5 days a week. And over the weekend, although there is no person that answers the phone, there is an answering system that is able to return calls the following day when someone leaves a call. It has the capacity of handling 7,500 calls per day and scheduling appointments. It has been actively involved in not only scheduling appointment, but also providing information. A lot of the calls sometimes are more about people that have concerns or they are seeking information. So we have established that the 866 or the 800 number that you see on the screen is what we have advertised, and it's what you can use with all your constituents and your residents in case they require an appointment for a vaccine. We also wanted to enhance our capacity at the two existing sites, the Taylor and the Livonia sites. So for doing that, we needed more vaccine administrators, and we needed to increase our hours of operations at those two sites. So we have increased our capacity to administer doses at the Downriver site, which is Wayne County Community College in Taylor, and we have increased our capacity from 1,500 doses to 3,000 doses per day. We also increased our operation per week from 3 days per week to 6 days per week. So we are literally Monday to Saturday at Wayne County Community College and have the ability to administer 3,000 doses per day starting this Monday. Yesterday was our first day. Schoolcraft Community College as well, we have increased our capacity with the same from 1,500 doses to 3,000 doses. And although our goal is to expand our operating hours to have 6 days a week, we have been inconsistently receiving Moderna doses from the state. In fact, this week, for example, we did not get any first doses of Moderna. So that remains limited hours based on the vaccine availability that we have. Currently, we have, like for this week, we have scheduled 4 days a week. If we have more Moderna coming next week, enough to operate for 6 days, then we will make sure that is happening. All this information is fed to our call center, and operators know exactly how many they can schedule on each day at which site. We also wanted to expand access to vaccine, as I mentioned, and have it more geographically accessible across Wayne County. This is a map of the county with the green circles are where we are currently, and the red circles are the new sites that we are proposing to, or we are going to establish. So we wanted to ensure that we have this distribution in the downriver area on the east side, as well as on all 4 corners of the county, while we still maintain our central presence as well. So we are launching 4 new vaccine sites. And of these vaccine sites, we are labeling them as large and medium. The only thing is that the large has a capacity of administering 3,000 doses per day, and the medium has the capacity of administering 1,000 doses per day. This has to do with the facility type and the facility capacity. The new sites are, the 2 large are Wayne County Community College, Ted Scott campus in Belleville, and Wayne County Community College in Harper Woods. The one in Bolded started operation on Monday, yesterday, so we opened our first site in Belleville yesterday. The Harper Woods is expected to open sometime next week. For the medium sites, we have 2 sites. We have Lincoln Park Community Center in Lincoln Park and Flat Rock Community Center in Flat Rock. Flat Rock also opened its doors for operation yesterday as the first day, and it's going to continue as we go along. So the 2 new sites are expected to come along very soon. Our goal is in a week or so. We are using the funding for these sites and the increased capacity, a mixed funding. We had a small grant from the state, but we also have a bigger reimbursement mechanism or grant from FEMA that is funding that. These are up to amounts. We are not using all the amount, but the total is close to $23 million in supporting this. The call center is currently operating through THAW as a short-term solution. There is an RFP that is also out, and we are looking for a long-term solution for a call center. There is technology needs, as I mentioned, the inventory system, as well as we needed laptops and ancillaries for registering and handling registration on sites. Those were funded through the FEMA funds, and they are purchased through several vendors. For increased capacity, we need people that can administer vaccine, but we also need people that can handle the logistics, such as traffic control and registration and the greeters. We also needed entities that can handle the supplies. So we have those as clinical and non-clinical, and we split those as enhancing capacity at our 2 current sites. Up to 2.5 million. This is a grant that we got from the Michigan Department of Health and Human Services, and we have sought 3 different vendors that are going to provide nurses and vaccine administrators at our 2 current sites to reach that capacity. However, we also need vaccine administrators at our 4 new sites, And again, we are using close to up to $12 million of the FEMA funds through 2 vendors that are providing the nurses that are needed. For logistics, operational supports, and supplies at the 4 new sites, we are using close to $11 million of the FEMA funds and using 2 vendors in supplying these services. We know that in order to be able to open up, at least for the 2 new sites and enhancing our capacity at the current sites, we had to purchase some supplies. So the county did purchase directly from McKesson medical supplies, and that was close to $350,000. This was also some of the FEMA funds. Lastly, the last expense is, excuse me, all the 4 sites, including the 2 existing sites, are entities that we negotiated with the owners of those facilities to lease those, and we have reached an agreement, and there will be expenses for those leases. In total, that is close to $880,000, and these are also using the FEMA funds. Most of these contracts are processed as an emergency procurement, which I believe are coming to the commission for approval. I think this week, if I'm not mistaken. Some of my colleagues can confirm that. I think this is my last slide, and I'll be more than happy to answer any questions either regarding this expansion or the COVID cases.
Thank you, Dr. Hamami. I wanted to clarify for those that are 16 and under, we were at first telling them to take the Johnson & Johnson. Is that correct?
No.
What are we recommending for 16 and under? And
at this point, Madam Chair, nothing. At this point, so the only vaccine that is approved for under 18, and that is 16 to 18 years old, is the Pfizer. And the Moderna and Johnson & Johnson are 18 and above. We know that there are currently clinical trials that are being conducted. We expect that sometime within, hopefully, the next 4 weeks, there will be some ruling on whether 15 years old to 18 years old can take the Pfizer, but that has not been ruled yet.
All right, and for the various other variants, I guess there's about 5 of them now.
Yes.
Do we find that the vaccine is helping to curtail the spread and or the I guess the deaths or sickness?
Yes, so far there has been out of 250,000 people that are fully vaccinated in Wayne County, there has been only 30 cases of vaccinated people who did have the infection. So that is almost 0.01% of that population. There has been only 1 death out of the 30 cases, and there has been 1 critical hospitalization. So we know that the vaccine is preventing infection, and it's certainly lessening the severity of the disease itself.
Great. And my last question, do we have any statistics, or are we even looking at how the antibody treatment is working or isn't working? Because I know that there are entities that are asking for those that had COVID to give blood for their antibodies. Do we have any information on that?
Not in numbers. I'm sure there is something, since we do not treat, then these numbers are probably
Mhm.
more with our health systems. But we know that there are several antibodies that are used in treatment as treatment protocols, and we know that they have been effective in again in the treatment of cases. So I'm not sure if whether they are still getting those antibodies from infected plasma. I believe they are now able to synthesize those in the lab.